No two facelifts are alike, and one of the things I promise my patients is that I really want to customize a facelift for each individual patient. So there's been a lot of talk about I have to have the deep plane facelift, or I have to have a vertical lift, or I have to have a high smash lift, or I have to have a composite lift. I can do all those operations, and I can do them very well. What I want is to do the right operation for you as my patient. So to give you an example of a case that I've done that is not exactly like all the others, if you look at her, she has aging in her face, but has developed more of a square shape to her face. That's because of the descent. There's a little bit of fat in the neck, and then the jowls have obliterated the sharp mandibular or jaw angle. So the goal here in a female is to give a heart-shaped face. Men have square faces, women have heart-shaped faces. So how do we accomplish that? So what I did was using liposuction, aggressively liposuction through the jaw area and the jowl, and then really got after the neck in terms of fat removal. Then I did a buccal fat excision, so giving the cheeks a little bit of angularity so that we could highlight the cheekbones here and here. Now you can elevate this mass and you can tie this mass in a high smash vector up here, but what I wanted to do is really create a narrower face, a more heart-shaped face. So what we did was we did called a lateral or strip smashectomy. So we took a big piece of this mass from the deep plane out. So that runs from the ear lobule up in an oblique vector. And then you tie those two pieces of this mass. So you're actually removing volume, which is kind of counterintuitive because we always talk about replacing volume. But in this case, what that created was a really thinner face with a more heart-shaped. Then we're able to tighten the neck muscle to give a 90-degree angle to the neck. So really love this case, and it illustrates why not all faces are just alike.